In Texas, a nurse practitioner billed Medicare more than $1 million per patient. Not per year, per patient, for a single medical device that cost a fraction of that to produce. She used the money to buy a Ferrari worth nearly $600,000, a custom Bulgari necklace worth $865,000. And she began construction on a $4.6 million beach resort in the Philippines. In Florida, another nurse practitioner spent her fraud proceeds on a luxury box at an NFL stadium and $400,000 in fine art. In another case, a man used the stolen identities of dead patients to file fraudulent claims, $27 million, built entirely on people who could no longer speak for themselves. And in one of the most disturbing cases in the entire operation, a cardiovascular testing company approved medical results in as little as 11 seconds. One patient, showing clear signs of a dangerously enlarged heart, was cleared for athletic activity. Weeks later, he collapsed on a basketball court and died. His mother's words to the court: "The doctor is as bad as any greedy criminal who is killing people in the streets." In June 2026, the United States Department of Justice announced the largest healthcare fraud takedown in American history. 455 defendants, 90 doctors and licensed medical professionals, $6.5 billion in false claims. This is the bust. Before we get into the cases, you need to understand the mechanism because it's simpler and more disturbing than most people realize. Medicare and Medicaid are massive, largely automated payment systems. The government processes over 1 billion claims a year. When a doctor or clinic submits a claim for a medical service or product, in most cases, nobody manually reviews it before payment goes out. The system is built for speed and trust, not scrutiny. Fraud exploits exactly that gap. The scheme doesn't require robbing a bank or forging a briefcase of cash. It requires submitting a piece of paper, or more often, a digital claim that says a medical service was provided, and letting an automated system approve the payment. If the fraud is well organized, if the paperwork looks clean, if the billing codes are used correctly, the government pays, often within weeks. This is why healthcare fraud has become, quietly, one of the most lucrative forms of financial crime in America. There's no vault to crack, no victim to convince to hand over their savings directly. Just a claim system moving too fast to catch every lie before the money is gone. Here's exactly how the biggest scheme in this entire takedown worked. The product at the center of it was something called a skin allograft, a biological wound care material made from donated human tissue used to help difficult wounds heal, particularly in elderly or diabetic patients. Legitimate allografts are useful. They're also expensive, and starting a few years ago, providers noticed something. Medicare's reimbursement rate for these products had ballooned to levels wildly disconnected from what they actually cost to produce. A product that might cost a few $100s to manufacture could be billed to Medicare for thousands of dollars per square centimeter. Fraud operators built entire criminal enterprises around this single gap. Prosecutors say that from 2021 to 2024, providers billed Medicare more than $4 billion for allografts from a single company alone, resulting in over $2 billion in actual payments. The pattern, again and again, recruiters would target elderly and often terminally ill patients, many in hospice care, many with wounds that would never heal, because they were dying of something else entirely. Nurse practitioners, sometimes with minimal or no direct patient interaction, would authorize allograft applications. Some products were never applied at all. Some were applied to wounds that were infected, or to patients who could not possibly benefit because they were actively dying. The billing codes went in. The system paid. This is the largest single case in the entire 2026 takedown. In the Southern District of Texas, prosecutors charged a nurse practitioner in a scheme involving $906 million in fraudulent claims. She applied allografts prosecutors say were medically unnecessary and billed Medicare an average of more than $1 million per patient. Think about that number for a moment. $1 million, on average, for every single patient who passed through this scheme. not the total fraud divided by patients treated over years, the average amount billed per person. When investigators moved in, they seized more than $30 million directly from her bank accounts. They also seized a $594,000 Ferrari, an $865,000 custom Bulgari necklace designed and commissioned specifically for her, and funds tied to a $4.6 million beach resort under construction in the Philippines, a personal vacation property being built in real time, with money billed to a program that exists to care for America's elderly and disabled. In the Middle District of Florida, a related but separate scheme, this one totaling $118 million. 3 defendants. Prosecutors allege that a nurse practitioner authorized wound allografts for patients who were targeted specifically because they were enrolled in Medicare, not because they medically needed the treatment. Some allografts, according to the charges, were never actually applied to patients at all, despite being billed as if they were. Others were applied to wounds that prosecutors say would never heal because the patients receiving them were terminally ill. The treatment could not possibly help them. It was billed anyway. With her share of the proceeds, the nurse practitioner purchased a luxury suite at an NFL stadium, a private box used to entertain guests during football games. She also spent more than $400,000 on fine art. Referring nurses in the scheme allegedly received kickbacks for every patient they funneled into the scam, turning vulnerable, dying patients into a direct source of personal income for the people who were supposed to be caring. In Nevada, prosecutors charged a nurse practitioner in a scheme approaching $1 billion in fraudulent Medicaid claims, again centered on skin substitute allografts. The victims in this case were described specifically as vulnerable elderly patients in hospices and nursing homes, among the most medically fragile people in the entire healthcare system, and among the least able to question or push back against what was being done to them or billed in their name. The proceeds were spent on luxury items. Prosecutors say those assets have since been seized by the government. The White House Anti-Fraud Task Force highlighted this case specifically as an example of exploitation at its most calculated, targeting people who were dying, who were often unable to advocate for themselves, specifically because their vulnerability made the fraud easier to commit and harder to. Not every case in this takedown was about stolen money. Some were about stolen lives. A cardiovascular testing company at the center of one case allegedly approved diagnostic test results in as little as 11 seconds per patient, a process that should, for a proper cardiac evaluation, take considerably longer to review. One patient's test results showed clear signs of an enlarged heart, a serious cardiac condition that can be fatal, especially under physical strain. The case was cleared. The patient was authorized to participate in athletic activity. Weeks later, he collapsed on a basketball court. Cardiac arrest. He died. His mother spoke at the announcement of the charges. Her words were direct. The doctor, responsible, in her view, was no different from any other criminal who kills people in the street for money. The only difference was the weapon was a rubber stamp instead of a gun. CMS Administrator Dr. Mehmet Oz addressed this case specifically at the press conference announcing the takedown. Fraudsters, he said, don't care about you. If they're willing to steal your money when you're vulnerable, they will take your health and they will take you. In a hospice fraud case, prosecutors charged a man named Oren David Shachar with generating $27.7 million in fraudulent Medicare claims. His method? Using the identities of deceased Medicare beneficiaries, people who had already died to file for hospice services that were never provided, to patients who no longer existed to receive them. He created backdated medical records to support the fictional treatment history, building a false paper trail for care given to people who were already gone. It's one of the coldest mechanisms in the entire operation. Living patients can sometimes notice something is wrong with their bills. Family members can occasionally catch a strange charge. The dead cannot object. Their names simply became inputs in a billing system, generating revenue for someone who never met them for treatments that were never given. The scale of this takedown meant prosecutors uncovered patterns repeating across completely unrelated defendants in different states, working independently. In Illinois, A behavioral health case involved $67 million in false Medicaid claims for services that were never provided at all. Patients billed for therapy sessions and treatments that simply never happened. In Arizona, prosecutors described a vice president of sales who allegedly orchestrated hundreds of millions of dollars in illegal kickbacks and bribes paid to sales representatives and medical providers, concealed through sham invoices, pass-through bank accounts designed specifically to hide the money trail from auditors. In Southern California, prosecutors allege that mobile medical services involving expensive amniotic allograft skin substitutes were billed to Medicare, while the nurse practitioner responsible for authorizing them was, at the time, incarcerated. The actual services, prosecutors say, were performed by someone with no medical license at all. Each of these cases, on their own, would be a significant fraud investigation. Together, in a single 2-week enforcement action, they represent something else, a systemic vulnerability being exploited simultaneously by unconnected criminals, all discovering the same gap in the same. This takedown wasn't the result of one whistleblower or one lucky break. It was the product of a specific technical innovation: data analytics. The Department of Justice's Healthcare Fraud Unit built a data analytics team specifically to look for statistical anomalies across the ocean of claims Medicare processes every year, the same core insight that has cracked financial fraud schemes throughout history. Fraud, at scale, leaves a pattern, and patterns can be found in data, even when no single claim looks suspicious on its own. It was this team that first detected an unusual, sudden spike in payments for skin allografts, a category of medical billing that should have grown steadily, if at all, but instead exploded upward in a way that made no clinical sense. That statistical anomaly is what triggered the investigations that led to the largest cases in the entire takedown. In response, the Centers for Medicare and Medicaid Services didn't just prosecute, they moved to close the gap itself. CMS restructured its reimbursement rate for allografts, cutting payment to $127 per square centimeter, effective January 1st, 2026, a fraction of what fraudulent billers had been extracting from the system. Officials noted that if the agency hadn't acted, the inflated allograft spending alone would have driven up Medicare Part B premiums for every single beneficiary in the country by roughly $11 a month, meaning every honest, ordinary Medicare recipient in America was, in effect, subsidizing this fraud through their own premiums, whether they ever received an allograft or not. The 2026 takedown wasn't just large in dollar terms, it was large in coordinated scope, in a way federal law enforcement had never previously attempted. Cases were filed in 56 federal districts across 45 states and U.S. territories. 50 state Medicaid fraud control units participated the most in the Department of Justice's history for a single coordinated action. The operation also involved unprecedented international cooperation. Several defendants had already fled the United States by the time charges were prepared. Through coordination with foreign law enforcement, some of those fugitives were apprehended abroad and physically returned to the United States to face prosecution, something that has historically been one of the hardest parts of prosecuting large-scale fraud, as we've seen in case after case where the person responsible simply leaves the country and disappears. Officials described the operation as representing a new era in federal, state, and international cooperation specifically built to combat healthcare fraud, a direct response to years of fraud schemes evolving faster than the enforcement mechanisms built to catch. It's easy to watch a story like Joe Lowe's yacht or Adam Neumann's tequila and feel a certain distance from it. These are stories about extraordinary sums of money, sovereign wealth funds, venture capital, abstract billions moving between institutions most of us will never interact with. This one is different. Medicare and Medicaid exist because of payroll taxes deducted from the paychecks of nearly every working American. They exist to care for the elderly, the disabled, and people who cannot otherwise access basic health care. Every dollar stolen through this kind of fraud is a dollar that either comes directly out of program funding or gets recovered through higher premiums, higher taxes, or tighter, more bureaucratic restrictions imposed on legitimate patients and providers trying to get real care. When CMS said that allograft fraud alone would have cost every Medicare beneficiary an extra $11 a month in premiums, that wasn't abstract. That's real money, taken from real retirees to fund luxury vehicles, custom jewelry, and beachfront property for people who were supposed to be providing medical care to society's most vulnerable population. The nurse practitioner who billed $1 million per patient wasn't stealing from a faceless government fund. She was stealing from the exact system her own patients depended on to survive. Every case in this series, from Adam Neumann's WeWork to Miles Guo's fake democracy movement, to Joe Lowe's stolen sovereign wealth fund, to this, follows the same underlying architecture. A system built on trust and speed, rather than verification. A gap between how fast money can move and how slowly fraud can be detected. And people willing to exploit vulnerable populations, investors, citizens, or in this case, dying patients, because vulnerability makes fraud both easier to commit and harder to catch. The specific mechanism changes. Bond issuances, shell companies, Livestreamed emotional manipulation, or, in this case, a billing code for a wound care product that costs pennies to bill and thousands of dollars to collect. But the shape of the crime is always the same. Find the gap in the system that's too big, too fast, or too automated for anyone to properly check. Exploit it as long as possible. And walk away with the money before anyone catches on. 455 people were caught in this particular sweep. Officials have been clear, this is not the end of healthcare fraud in America. It's one enforcement action against a threat that adapts as quickly as the system's built. $6.5 billion, 455 defendants, a Ferrari, a Bulgari necklace, and a beach resort, all paid for by a program meant to care for the sick and the dying. And somewhere, right now, someone else is finding the next gap in the system. Follow the bust files, because the money always leaves a trail even when it's stolen from people who can no longer speak for themselves. Subscribe. New case file every week. The Bust Files. We follow the money so you don't have to guess.